Welcome to the Family Health with Dr. Lex YouTube channel. I'm Dr. Lex. Today we're meeting Dr. Kim Duramo to discuss EFT tapping to reverse pain, illness, and fatigue. Dr. Duramo is a conscious physician, best-selling author of the MindBody Tool Kit, and founder of the American Institute of MindBody Medicine. She received her board certification in emergency medicine after completing residency at Emory University in Atlanta. Let's welcome Dr. Duramo to the show. Good morning. So I am here with Dr. Kim Duramo, who is an osteopathic emergency physician based out of Durango, Colorado, but practicing virtually anywhere in the world. Anywhere in the world, Kim?
Internationally.
Amazing. Welcome, Kim. Thank you so much for being here. Today, we're going to talk about EFT, which is emotional freedom technique for chronic pain management, fatigue, emotional stability. And I would just like to welcome you. Thank you so much for being here.
I am so excited to be here. Yeah, it's funny because we think as doctors, it's all about management. And it actually is like chronic pain resolution, you know? So same thing of what you're doing, like you're helping disease resolve instead of helping people manage disease. And EFT is a really powerful way I found in my practice to use with people for that resolution, but also to have people use for themselves.
Beautiful. I love it. I love it as a non-medication, as a tool among many that is used to treat so many different things. But first, before we talk about EFT and the emotional freedom technique and its utility, I want you just to start by telling me how you went from being an emergency medicine doctor to developing an international practice, helping people resolve their conditions with EFT.
I have been aware from a really young age, before I even became a doctor, that I wanted to bring this message that the body heals itself, that the mind and body are connected. I studied this for years and years before I went to medical school. I was really connected in my own body and aware of how my body was responding to my own thoughts, my own beliefs, what I was thinking about. And I understood there was like a big piece missing in the foundation of conventional medicine that really was throwing everybody off when we're looking at what's happening with a patient. So I studied emergency medicine, and I did this because in the allopathic model, that is one of the best uses of that approach. So, if your arm is off, we can put it back on. If your heart is stopped, we can start your heart back up. We can do unbelievable things for acute illness, acute severe injury, trauma, critical care illness. It's for chronic illness that we fall apart. And then there's really very, very little that we have to offer in that model because, we're managing, but are you actually helping anyone heal? In conventional medicine, we learn nothing about how the body heals, how to support healing, how to resolve disease. We learn how to manage it, but that's not what most people are looking for, right? It's like, wait, how do I actually have vitality and be free from disease? So I knew that this was a big piece that was missing, and I studied everything I could about this. I had experienced a pretty severe autoimmune disease myself during medical school, and I went through that whole journey myself where I was told, here's all the medicines you need, here's what you can and can't do, you'll never be a runner again, you won't be able to travel the way you're traveling. Like basically my life fell apart. But this was after maybe a year to 2 years of searching. What's wrong with me? What's wrong with me? And getting really kind of nowhere. And then I got this diagnosis. And so part of it was like, oh, someone finally can help me.
Right.
But I realized like, wait, they're not actually helping me. This is just a big limitation. And it was so heavy to buy into the idea of what he was telling me. You have this obscure form of juvenile late onset rheumatoid arthritis. You have this all different kinds of food allergies. And I thought the more I was listening, like, oh my God, just kill me now. Like, this can't be my truth. This is not a solution. This is a nightmare. And I actually started to ask that day, what else is possible here? Is this actually true for me? And to expand beyond, the question I was asking before, which was, what's wrong with me? What's wrong with me? And I was in this constant fight or flight trying to solve it, escape it, versus, okay, body, what's right about this? I'm not getting, and finally being willing to receive it. And I wouldn't have gone there unless, I really, really had to. And I know for most people with a severe illness, you don't necessarily open to something new until life brings you past the point of what you can manage.
Yeah.
And so it was within a really short time that I had an entirely different awareness in my body, an entirely different conversation in my body, and really letting in what was happening instead of trying to reject it, overcome it, fix it. And the symptoms resolved within just days, a very, very short time, because my body was just talking to me, trying to like give me a communication. Kim, stop pushing the boulder uphill, stop working so hard to overcome slash achieve slash, go for it. Just be who you are, and let that be enough. It will come through you. I mean, it was a pretty big message, but it changed the course of my life because I had understood the body heals itself. I had studied MindBody medicine, but until I had to integrate it in myself, it was just information. And now it was like the most profound awakening experience. And that is really when I knew that I would bring this in my practice, that I would take my practice in a different direction. So here we
You
are.
bring up a great point about how the diagnosis, the name, when there's a kind of mixed emotion when patients are diagnosed with a condition, whatever it's called, because in one sense you're like, oh, okay, well, finally there is a name that I have for what I'm feeling. But we have, I believe, convinced ourselves that once you have a name associated with your collection of symptoms, then you relinquish control over that disease. It is
Oh
something
yeah.
that's happened to you, and that it is there for the doctors and the experts to fix with whatever treatment, surgery, procedure. And there's a mindset shift that happens there where we relinquish control over our own bodies. And a lot of people will not participate in their care. And then there's a certain set of people who will, like you, go looking for whatever I can do to make my body better, to help my body heal. And I think that that's kind of the double-edged sword of naming a constellation of symptoms and giving someone a diagnosis.
Yes. And all the conclusions that go along with it,
Yes.
like you'll have this for life, or you have this disease and therefore you have to have medication. So
Yes.
you've got to be willing to look, okay, great, maybe this is what's going on, but does it actually mean any of those things?
Right.
So I tell people to play the heavy light game. If you're buying into a lie, it's always going to feel heavy. If I bought into this doctor's idea of what was going on with me, like it felt so heavy, I was like on the floor. So heavy light, your body's not going to lie. So if you just ask, what else is possible here? Is this true for me?
Yes.
You'll be able to feel. You've got to develop a connection with your body first, but it's night and day. You can't miss it. You'll feel like, oh, the heaviness of buying into that conclusion versus the lightness of opening to a new possibility.
Yeah. And we're both osteopaths. One of the primary overriding principle of osteopathic medicine is that the body has everything it needs to heal. If you treat it well and you fuel it with the right fuel and you expend the right energy and you give it what it needs, it has the capacity to heal from most things. And your philosophy and approach is an extension of that osteopathic philosophy. So tell me, what is EFT? What is tapping for people who don't know or have no idea? They know that you think that it can help. They know that you love it and it has helped transform your life, but what actually is it?
Okay, so this is just a way of giving new information to the brain, nervous system, endocrine system, immune system, letting a repatterning happen to sort of remove whatever is suppressing health. So you start just gently tapping on different points in the body. These are acupressure meridians. So they're energy currents that travel through the body that we now have lots of science to demonstrate how energy moves through the body. So when there is suppression, so for example, for me, here I was in medical school, go push harder, do more, achieve. But there was this underlying, I'm not enough narrative that I had bought into subconsciously that was flowing through my system. And so any of our thoughts or beliefs or perspectives are literally cellular messages. So it's not only that we'll see brain activity light up a certain way around that, we'll also see communication through the digestive system, communication in our hormones, our endocrine system, communication in our immune system. And we know these are really important. We don't really appreciate in the conventional model, how powerful these messages are. They're not like the afterthought of like, well, we've tried everything, so maybe we'll do this mind body thing.
Mhm.
Or what I see a lot of people do is, well, it's really severe, so we have to do, the big guns and use medication. But for things that aren't as severe, maybe they can go in that category. No, 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 no. I have seen some of the sickest, most severe, in the bed, in a wheelchair. I am so sick with autoimmune disease, I can't work anymore. Patients completely recover. Severe Lyme disease, infectious diseases that won't clear, autoimmune syndromes, MS, who have resolved and are walking and functional and happy and vibrant and energized. So I would say that's a big misconception people have, is that it has to do with the severity, whether or not you need medication or you can use an approach like this. So in getting back to what you mentioned, I'll just relinquish control over to the doctors because they know what they're doing and I don't. This is kind of a universal pattern I've seen in the patients I've worked with, where they had that turnaround. They realize, like, wait a minute, that's not working for me. How do I get back in to connect with my body and actually orchestrate this and see what's going on? And EFT is a really great way to do that because it makes you so much more aware of what's happening in your body.
So is EFT and tapping, is it something that is prescribed? Like, is that if for a particular condition, do you prescribe a certain sequence or a certain technique? How does it work?
Here's how I do it. So I will have people connect with their body. We'll do some sequence right now just to breathe, feel your body, become aware of what's happening inside you. And then we can just do some general tapping for like stress or anxiety or whatever might be happening. You, as the tapper, will become more aware of what's going on inside you. You may feel sensations much more fully. You may feel emotions come up and rise to the surface. You may have thoughts that you're like, oh my God, I didn't realize I was thinking and believing that. So thoughts that become more conscious that have been unconscious. So it isn't so much that I'll tap for like, oh, you have this syndrome, here's your tapping prescription. I will have someone connect with what's happening for them. What are the physical sensations? So we do like 3 categories: physical, mental, emotional. For many people, they're so unaware and disconnected from their body that they're suppressing emotional, they're suppressing the mental dialogue, and maybe suppressing 90% of the physical. And that's why the pain is so loud and so screaming, because the body's like, come back, I need you here. And so we want to actually go into the pain, not give you more prescriptions to escape the pain. But this is what lets the energy resolve. It actually lets the energy move. Pain is suppressed energy. It's energy that's stuck in the body that we're not making space for. So, going back to my stance where I'm like, I've got to be a better person because I secretly believe I'm not enough. There was a particular kind of tension physically in my body. And I had this severe pain syndrome. But there was also this way of being, right? Drive, overcome, push through, which is kind of one of the things I see universally with Lyme, with autoimmune disease, Hashimoto's, MS as well. So we aren't going to, no, I'm not going to succumb because that would mean quitting and then I'll just be taken over. We really buy into the idea that the illness has power in and of itself, but it only has the power we're giving it by resisting. So for me, it was a big step of courage to allow all this energy to move through and stop fighting it. But like I said, it was days. And I've had so many people tell me the same thing, like right away. They'll feel a release, a resolution, a lightness. Many people will tell me their pain went away just watching one of my YouTube videos, their depression, anxiety resolved, and that they began to have insight, which is kind of those other 2 categories of what is going on underneath those physical symptoms.
Can you show me or guide me through so we can like get an actual kind of little demo? Yeah. I'll pay you later for your expertise.
Yeah. Okay.
How does it work?
So we start with the karate chop point, and this is just the outer pinky side of the hand, and you gently just start tapping. You're breathing in You're breathing out. Let your body soften because that's going to be letting a lot more awareness in. And you can tap one side or both sides together, really doesn't matter. So you just gently relax your body, relax your shoulders. And before we do that, I like to have people put their hand on their heart, take 3 to 5 breaths into your body, soften your shoulders, and just become aware of what's here. Okay. So what's here may be, oh, I feel really anxious about my day, or, oh, I feel bad about this thing that happened, who knows, yesterday, or there's physical sensations that are getting your attention. So you've got to check in. So just hands on your heart and just say, hi, body, how are you? Have a few breaths and breathe right into your heart center. And then you can tell me what you're noticing in your body, could be anything. And on a scale of 1 to 10, how severely it's getting your attention.
So just right away, I'm drawn to like right hip pain, which has kind of been there intermittently. But as I'm sitting here, just kind of still in this position, not wanting to like readjust, it's like right hip pain.
And you said not wanting to readjust. Is that a like annoyance? Like, ugh, I don't want to mess with this. What's that piece?
Yeah. Or just like, as I'm speaking with you and just kind of interacting with you, of not wanting to interrupt to address my discomfort.
Okay. So it might be a little like layer of, I don't have time for this. This is not important.
Yes. Or yeah, it can wait.
We want to get into that because it will actually give us a lot of where the energy is. Okay, great. So we're going to start with that. And for anyone listening, do your own little check-in. And what scale of 1 to 10, what would you give it as a number?
Probably like a 5 or 6.
Okay, great.
It's there. It's not killing me.
Great. So everyone check in. Is there some physical sensation? Are there any other energies like, oh, this is just so annoying? Or what I see a lot when people have chronic stuff is like the fear it will get worse, the despair, I'm powerless, nothing I do ever helps. These can be really heavy energies. So just be real gentle with yourself as you allow them to be seen and to start to move. And then we'll do the karate chop point. So you're going to repeat 3 setup statements just to harmonize whatever's coming up. So you'll say it out loud and you say, even though I have this right hip pain,
even though I have this right hip pain,
I choose to be at peace now.
I choose to be at peace now.
Even though I don't have time for this.
Even though I don't have time for this.
I'm going to just push it aside.
I'm going to push it aside.
I choose to embody myself fully.
Choose to embody myself fully.
Even though there's this annoying hip pain.
Even though there's this annoying hip pain.
And I have better things to do.
And I have better things to do.
I choose to embrace myself fully.
I choose to embrace myself fully.
Good. So that's the setup phrase. It's actually to neutralize. Even though I can't stand this thing, I choose peace now. Okay. So now we go to the inner eye point. So just gently tap, breathe in, breathe out. And you can repeat after me. Noticing this right hip pain.
Noticing this right hip pain.
Outer eye. Can I really put energy into this now?
Can I really put energy into this now?
Under the eye. I have a plan I'm focusing on.
I have a plan I'm focusing on.
Under the nose. I have places I'm trying to get here.
I do have places I'm trying to get.
On the chin. I'm focusing on what I have to do.
I'm focusing on what I have to do.
Under the collarbone. I don't have time for my body.
Oh, I don't have time for my body.
Under the arm. This way of not having time for my body.
Not having time for my body.
On top of the head. I learned this.
I learned this.
Inner eye. I learned to be with myself like this.
I learned to be with myself like this.
Outer eye. I wonder what it's doing to my body.
I do wonder what it's doing to my body.
Under the eye. I wonder how I could incorporate my body into what I'm doing.
I wonder how I could incorporate my body into what I'm doing.
Under the nose. Let my body be part of the equation.
Let my body be part of the equation.
On the chin. Maybe my body has something to contribute.
Maybe my body has something to contribute.
Under the collarbone. Maybe my body actually does have some wisdom.
Maybe my body does have some wisdom.
Under the arm. Beyond my agenda.
Beyond my agenda.
Top of the head of what I think I need to do and where I think I need to go.
What I think I need to do and where I think I need to go.
Inner eye. Feeling and sensing my body.
Feeling and sensing my body.
Outer eye. My right hip.
My right hip.
Under the eye. These are uncomfortable sensations.
These are uncomfortable sensations.
Under the nose. It seems easier to just reject them.
It seems easier to reject them.
On the chin. All the ways I make sensations wrong.
All the ways I make sensations wrong.
Under the collarbone. All the ways I suppress my body in general.
All the ways that I suppress my body in general.
And only listen when it's screaming.
And only listen when it's screaming.
Under the arm. Like my body is an inconvenience.
Like my body is an inconvenience.
Top of the head. I wonder what else is possible.
I wonder what else is possible.
A big breath in through the nose. And then powerful breath out through the mouth. We're going to do more, but I want to check in. Where we went was a lot deeper than where someone might just go on their own, where I'd have them tap on this right hip pain, what it feels like. It's sharp, it's dull. It's been there for 5 years, ever since I had that accident. You'll tap on the specifics of what you do know. That's a great place to start. We did something deeper, but I want to hear what that was like for you.
So the physical sensation was very, I almost felt like hollowed, I want to say, is the kind of the way, like there was an emptiness and maybe even like a little bit of tingling kind of sensation as I moved throughout the different parts. I also felt like focusing on the words you were saying. I was really identifying with what you were saying, and like what the things that you were saying, I think could be universally true for a lot of people. And as we both know, there are a lot of people who displace or neglect what their body is telling them in preference for something else that they consider more pressing or more important or urgent. And so I think in that moment I was just, or in that time that we spent just really sitting with something that, like you said, has been neglected or I've put off in preference for other things. So that's like, yeah, like what you're saying is right. It was affirmative. It was affirming.
Okay, good. So it resonated.
Yes.
This is a big piece we have completely misunderstood in conventional medicine, that the body is on board for your greatest expansion. So in medical school, I thought my body was going to hold me back and I've got to go do this thing. I've got to fight my body. That didn't get me anywhere. So thankfully I was willing to open to something else. But that's what so many of us are doing, because we have this idea that the body is wrong, that the sensation of, call it pain, call it illness, is wrong and bad, that we know better than the body's wisdom. I mean, it's insane, because we actually do have really powerful wisdom that we pick up on through the body, from, call it your higher self, or call it God, or call it spirit or source or whatever.
Mm-hmm.
The body is very receptive and can allow clarity in, like, oh, this is the place I'm going to send my kid to school. This feels right. This is resonating.
Mm-hmm.
Or, oh, this is the thing to do right now. That's the person I'm going to call, or whatever. You make choices in your business every day. If you're connected with that wisdom, it's like massive synchronicities and serendipities and fluidity, doors opening, prosperity happening. Same with the body.
Yes.
We do the opposite and we leave the body out of the equation. And it's like, no, I got my agenda. I got to do this thing because I'm actually really convinced I'm not enough. So I have to override my body. Well, I'm on like a long path to nowhere.
You make great points, because especially as women, goal-oriented, multiple obligations, professional, personal, family obligations, we are we are trained and brainwashed by society to think that we have to push through all of that to be strong, and that our end point is something that is evidence-based. It's something that is rational and reasonable, and that we need to use logic and prospective thinking about how we're going to get from point A to point B.
Yes.
Neglecting the process, number one, and number two, being kind of forced to suppress how we feel about those choices and that path. So you bring into light something that we have been conditioned to disregard.
Yes.
And that's really like, I've never even thought like, I'm a scientist, we're scientists. I'm a thinker, not a sensor, and these are issues, I think, that regardless of what your industry is or what your obligations are, we've all been taught to disregard that.
Yeah. And it's a big, like this big black box that's so unexplored.
Right.
Like when I work with people, they'll say, how did you know that? And it's really easy because if I sense in my body and sense through my awareness, it's so clear. It's like the sky is blue. How do I not know that? But I've got to be super connected with myself and be a sensory being.
Yes.
And just like you said, we learn this. We learn to neglect the body. We learn to focus on the outer. If we shift and start to focus on the inner, 99% of everything resolves for us. It is such a different way to live.
Well, what I feel is that this is a very modern thing. I feel like before medicine and surgery and all of the evidence-based revolutions and inventions and that have occurred in the last century, we were more connected maybe with how we felt about things.
Yeah.
And now that's all that ancient stuff where that medicine we used before we had medicine was more mind body, was more connected with what you're feeling and what you're thinking and how your body is moving throughout the world. And now in modern medicine and science, it's an investigation. It's an investigation into what's physically wrong. And it is a prescription to fix what is physically wrong, or to band-aid what is physically wrong.
I would give people the prescription instead to have the courage, because it does take courage when you think that has to happen that way, to do it differently. To have the courage to, instead of trying to get somewhere, focus on being here. So instead of trying to get there, that thing that's better, like when my body heals, or when I finally get pregnant, or when I make $1 million, whatever the thing is, be more willing to be here, because your power is actually here. Your body can only live in the now. It cannot live anywhere else, in the future, in the past, outside focusing on other people. It can only be here. You can only access your power here now. And the body's a great portal to enter the now, because the body can only live in the now. So you'll bring your attention to feel your shoulders. Oh, let me just like relax my shoulders. What does my breath feel like moving through my body? Do I feel my breath come down into my pelvis, or am I just breathing up here in the chest and fight or flight breathing?
Yes.
Okay, let me just see if I can smooth that out a little. And oh, wow, I feel all the way down to my belly. When I've asked women sometimes to sense into their pelvis, they're like, oh, no, I can't bring my awareness down there. Like, this is just too sensual. I'm not going to let myself have that much sensation. And I'm like, what? You don't want to suppress. This is the doorway to unthinkable healing happening, is you being here with you.
Incredible. I love it. Why do you think that you and I both, we've discussed in the past how we both will encounter patients who come to us because they have a complex or obscure set of symptoms that all the traditional medicines, they've tried everything, they've seen every doctor, and nobody can either diagnose them, nobody can figure out what's wrong, and therefore they certainly cannot they certainly have not found a treatment plan or a regimen that will help them. Why is that, number one? And how does EFT change that for patients and for us?
There are kind of these three major deep energies that universally underlie those illnesses, those symptoms, those syndromes that I've seen in my practice when someone is very sick and not getting better,
Hmm.
or having this problem and no one can help me.
Hmm.
And it is always, there's underneath it despair, fear, sorry, grief, despair,
Uh-huh.
powerlessness, and fear. 100% of the time. Why I give my power away and say, "Oh, help me, help me. Oh, you're the one who's going to help me. Oh, no, it's you." It's because I don't know that I'm powerful. So I've got to go to the best doctor or the best energy healer or their best whatever, because I don't know that I'm powerful. So when I bring people through tapping, begin to, just write down the specifics. Start with physical. Physical is, what is the pain? What are the sensations in my body? What is the fatigue? What are the limitations? What are the specifics around it? Like, when did it happen? How often do you get the migraine headaches? So you just tap on that, just start there. You will feel, after like maybe the first or second round, the heaviness of buying into this delusion that you're stuck, you're limited, you're powerless. You're in lack. It's outside you and you don't have it. I'm lacking. I don't have what I need. This will connect you with that. And I've had people just break down and cry, or lots of yawning, tears, energy moving, just tapping on those basic physical things. Then you can do a little tapping on the deeper energies as well. And what this does, now, do not tap to make them go away. Do not tap to make your illness go away. Do not tap to make your pain go away. Do not tap to make the depression go away. Tap to nurture yourself through it. So there's three things that will happen when you tap. A, you'll feel lighter. You'll feel the complete resolution of symptoms. Awesome. B, you'll feel things intensify. Whoa, the pain's now like a 10 out of 10. Or, oh my God, I feel so hopeless. I didn't even know I was feeling this. It will intensify. It's energy coming up that's been suppressed. Do not make this wrong. You do not want to shove it back under the rug. I swear to God, it will continue to move. Or three, absolutely nothing. And what I see with that third category is kind of like the arms crossed, prove it to me. I don't feel anything. And what that is the layer of protection of like, I already know what I know. I'm not really going to let something new in.
Hmm.
And for that person, I would say, are you willing to experience something new? So if you are, just soften your shoulders, breathe a little more fully. This shift has happened, but not in a dimension where you're giving your attention. So if you
Hmm.
just soften your body a little more, you will begin to feel what's happening.
You have to kind of accept it and accept the pain, accept the
That it is,
fear,
instead
yes,
of trying to push it out. I mean, that's what we do in medicine, right? Is like, you have a symptom, boom, let me make sure you don't have that symptom
block
anymore.
it.
But did
Yes.
I actually help you heal?
Right.
Not so sure about that.
Oh man. I mean, I feel like I've been intervened upon. I mean, these are tools. These are treatments. These are life changing healing methods. And I mean, I have to tell you, I have not changed my position. You haven't seen me get up or move around. It does feel different. I'm not going to say the pain is gone, but the discomfort feels different. And when you combine that, then I mean, I've had this hip pain for a long time. It's an old injury, but when you combine that with OMT or with physical therapy or with stretching, massage,
Yes, now your body can let go of whatever the tension is. Otherwise, you're like holding it on, and then maybe you get a treatment, but you're still holding it. So it's going to
yes,
come back. We can do a little bit to complete, to just help people kind of open up to that next layer. A little bit more EFT if you want to do that.
yes, let's do it. I'm ready.
Okay. So we'll just continue from where we were there, and just inner eye,
Okay.
gently tap. What would it take for me to open to my body?
What would it take for me to open to my body,
Outer eye, to let something new in.
to let something new in?
Under the eye, even if I'm scared of these sensations.
Even if I'm scared of these sensations,
Under the nose, even if they're not comfortable for me.
even if they're not comfortable for me,
On the chin, to soften anyway.
to soften anyway.
Under the collarbone, and let the energy move.
And let the energy move.
Under the arm. So I'm more connected with my body, not less.
So I'm more connected with my body and not less.
Top of the head, more resilient and allowing.
More resilient and allowing.
Inner eye, I wonder what would come through for me.
I wonder what would come through for me.
Outer eye, insight, awareness.
Insight and awareness.
Under the eye, energy, vitality.
Energy and vitality.
Under the nose, a lot of things I've been seeking out there.
A lot of things I've been seeking out there.
On the chin, what if I get in harmony with my body?
What if I get in harmony with my body?
Under the collarbone, starting with these pains or sensations.
Starting with these pains and sensations.
Under the arm, through the doorway of this illness.
Through the doorway of this illness.
On top of the head, by receiving what's here now.
By receiving what's here now.
And continuing to let life in.
And continuing to let life in.
Good, big deep breath. Let it go.
Feels good. It really does. It really feels good. Are those scripts that are those, do you have that for people to recite somewhere? Should we be giving ourselves affirming thoughts? How do we know what to say or what to think when we're doing the physical act of tapping?
I have really great free resources on my page on my website, drkimd.com/EFT, emotional freedom technique, drkimd.com/EFT. And it will give you some guidance around like, okay, if you have anxiety or, what you might have pain, what's going on. There's a lot of videos on my YouTube channel. And I did create a mini course if people want to purchase that gives like scripts and a little more like prescriptive, if you're having this, if you're having depression, if you're having fatigue, and you can go deeper. But there's a lot of stuff on my YouTube channel. And if you practice with yourself, I'm telling you, it is going to bring up a lot of energy. But if you stick with it and just, put your hand on your heart, I'm committed to be at peace in my body. That will let you come through full circle to let these energies move. Like I said, under these chronic severe illnesses, it's despair, grief, that we're like, no, I got to put that away. Powerlessness and fear. And we've just been in this big conclusion that we are not powerful, big, strong enough to meet those and let them move through our experience.
You're a light, you're a gem, you're a gift to our profession. I will put all of your access points, drkimd.com, your YouTube channel. I will put them in the show notes. I will put them on my website. You can find Dr. Kim on my website so that everyone has access to you. But the last question I want to ask you before we go, 2 questions actually. What do you say to the doubters and the people who say that energy work, is not effective or real? And how can we get started? How can someone get started on this journey to incorporating EFT as one of a multidisciplinary treatment plan?
So I would say for the people who are in doubt that really aren't ready, there's really nothing I have to say. People either know there's something in them that's ready to awaken and they follow that spark and they follow that yes, and you will always be sourced beyond imagination. And certainly what I'm doing is a great resource for that. And if you're in that space where you're like, well, I don't know, maybe, but I'm a doubter, just be exactly where you are, but more consciously. Because when you do this, you're going to feel your pain. You're going to feel the contraction that doubt is creating in your life and your relationships and your health. And then you may start to open to a different possibility. So it's got to come from you, but that might be the one little tweak is like, be more aware of exactly where you are, receive where you are, but do it more consciously because life will guide you to your own opening. And then I would say the best place to do a weekly live broadcast on Wednesdays at 11 a.m. Mountain Time. It's called MindBody TV, and people can join live either through my YouTube channel or in the MindBody community in Facebook and ask questions, share, what's coming up for you as we do tapping or other MindBody tools, and connect with me that way. They're recorded, so if that time doesn't work, you can just, they're all backlogged, and you can watch the recordings of these. They're really, really, really powerful. So I would invite people to that as a starting point. I do have some home study programs that will teach you to integrate this more deeply for yourself. Or I do work with people live in a group called Embracing Health, where it's a year-long integration where we really do like a deep journey with you connecting with yourself. And I've had some really incredible stories and testimonials and people coming back to share the resolution of their disease or illness or chronic fatigue syndrome or all kinds of really incredible things. So I'm really grateful to be continuing that as well.
Oh my gosh. So Dr. Kim D is where we can find all of those resources. Like I said, I'll put all of that information. Thank you so much for being courageous and strong enough to bring something that may seem unconventional or alternative, or I'm sure you can list to me the research that's been done, and I'm sure we can read about the research that's been done. But in a world where we are looking for studies and for proof, I just cannot applaud you enough for being strong enough to speak on something that you clearly believe so strongly in, and clearly have the living proof that it is an effective way of connecting with yourself, your condition, your disease, your illness, your symptoms, and that you see it as a way forward, and that, this can be used as a treatment tool. I think it's very powerful. I think that you are a trailblazer. I love your spirit. I love your energy. And I'm just so glad to know you. And thank you so much for being here with us and for sharing all this information with our people.
I'm really glad to be here too.
We'll catch up soon, Kim. Thank you again. Bye.
Okay.
Thank you.
Bye.
For more from Dr. Duramo, you can check out her website at www.drkimd.com. You can find her on Facebook in the MindBody community, on Instagram and YouTube at Dr. Kim Duramo. You can also find more information on my website, drlexlifestylemedicine.com. See you next time.